back.
Welcome back to Open Line. We are talking all about the Affordable Care Act. This is your chance to call in with any question you may have about your situation. How do you sign up? What's most appropriate for you? Happy to have with us Mary Hunt with Get Covered Tennessee, the coordinator and ACA navigator, and Sharon Barker, the lead navigator with Family and Children's Service. So lots of knowledge here. Great opportunity. We have some calls. Let's go to Tony. Hello, Tony.
Hello, good evening.
Hi, what's on your mind?
Well, I don't know if this is how unique of a situation this is, but I'm just trying to find that out now. I live next to an almond. I know that.
You live next to what?
My,
What did you say?
my religious beliefs also preclude me from using conventional medicine and more natural means, and therefore I don't use the medicine that this would require to use. They're getting, the Amish people here are getting a group exemption, religious exemption somehow, and I haven't been able to find out through calling this number how I can apply for that religious exemption, because I hold this pretty much the exact same beliefs that they do, and I wanted to see if I could find that out.
Very interesting. So you want a religious exemption that would exempt you from having to get coverage.
That's correct.
Okay. And that's all right. What about that?
Good question, Tony.
Very good.
There are exemptions. There's several exemptions from the penalty. Religious conscience is one. You can apply for it through the marketplace or when you file your taxes. If you apply for it through your taxes, it does have to be a religion or a sect that's recognized by the IRS as having a conscientious objection to conventional or modern medical treatments. So it is definitely an option. Now, I'm not sure what number you were referring to that you had called before, but you can call our number and get an appointment with a navigator or someone to help you apply for the exemption.
So we'll put that number up, but when we put those numbers up, it's the one to the navigator. Okay, thank you. Thank you, Tony. Interesting call. Let's go to Tina. Hello, Tina.
Hi.
Hi, go right ahead.
Okay, so I had insurance up until June through where I was working. And then when I lost my job in June, of course, I lost my insurance. Now, technically, I qualify for TennCare because I do have a dependent under the age of 18. However, I am having trouble applying for TennCare. When I go to the Department of Human Services, I'm told to use their computer. When I use their computer, I set up my email like it tells me to, and then it kicks me out. So then I ask the Department of Human Services, the lady, to help me, and she says she can't. All she can do is tell me to use the computer. So I go back to the computer. It's the same thing over and over again. So at this present time, I do not have insurance. So I use a clinic that does it, like just based on your pay. So what can I do to avoid being penalized on my taxes?
May I ask you what county you're in, Tina?
Yes, ma'am, Rutherford County.
Oh, okay. Yeah, you'd be a great candidate for calling and getting in-person assistance with a navigator. I would definitely call the 1-844-644-5443 number and make an appointment. As a matter of fact, we'll be in Rutherford County on Friday at
The St. Thomas Rutherford Hospital.
And we have our schedules in the connector. You can probably make an appointment to see one of us on Friday if you'd like. We'd be happy to help you with that.
Okay. All right. I appreciate it.
All right, well, thank you. So is that a story you've heard before, that signing up for TennCare is very difficult? Somebody goes to the office and it's just not an easy process. Have you heard that?
Yeah, well, especially when they go and just are told to go to the kiosk. And if you're not familiar with how to navigate healthcare.gov, just sending somebody to the kiosk that's not really familiar with how to navigate the whole process, it can be quite difficult for some people. And some people are just not computer literate. They're just not very comfortable with the whole process of going onto the computer to do anything. So we have had that complaint quite often.
And even for some folks who can normally are good with computers, healthcare.gov can sometimes have we know the tips and the tricks of the trade and how to get in there most efficiently and get those accounts started. So So that is something we hear, and we can help her apply for TennCare. We can also help see if she qualifies for an exemption for this past year.
Well, good, because that sounds frustrating to go there. Maybe she has a child with her, and all she has, she has to go to a kiosk and do all this stuff, and then keeps getting. I'm glad. I think we have some more calls here. Line 2. Let's go to line 2. Thomas. Hello, Thomas.
Yes.
Go right ahead.
Yes, I've got a couple calls, and I think you may have already answered a few and may have gave out a few phone numbers that I can call to get some help. But I did try to enroll last year and whatnot, and it was just kind of hassle for me to try to find anything that I could afford, and so I guess I missed the sign-up date. Looks like I'm going to have to pay the penalty this year. And I guess you gave out the numbers. I guess, is there like the 800 number or something I can call to enroll over the phone, or do I have to, like you say, meet with somebody and go somewhere to do this? And I guess that was one of my questions. And then another question I've had is about an exemption. I went to the healthcare.gov website, and it said about an exemption for 2015 if I have lived in a state that hasn't expanded its Medicaid program under the Affordable Health Care Act, and that is one of them. And then the other stipulation was if my household income would have qualified me or my family for Medicaid in the state if the state would have expanded its coverage. And I was just wondering, and Tennessee was one of those states that didn't expand its coverage, and it pretty much says on the healthcare.gov website that people in those states who would have qualified for Medicaid are exempt from paying the penalty. So I was just wondering if you could give me any information on that. And any.
All right, well, let's talk about that. That's interesting. All right, we'll put up the 800 number a little later. What about the exemption he's talking about?
That is an exemption because it would be unfair to penalize someone for not getting coverage when they could have gotten free coverage if our state had expanded its Medicaid program. So it depends on the household size, what the income limit for that is. It's 138% of the federal poverty level. So it depends on the household size. For one person, it's about $16,000 a year. So if you're a single person and your income's under $16,000, even though you could sign up and get very affordable coverage, if you're over $12,000 and under $16,000, you technically don't have to sign up because you wouldn't be penalized if you didn't.
So in Tennessee is one of those states where there are people who would not be penalized, but there are people who would be penalized. There are people, just because you're in Tennessee, it's dependent on your income.
It's completely dependent on your income.
As to whether you're penalized or not.
If your income is high enough to where you wouldn't qualify for TennCare, even if we had expanded our Medicaid program, you will still be penalized. But if it's too low to qualify for the subsidies, and then there's a little overlapping where you could qualify for the subsidies, but you're still under 138% of the federal poverty level.
Is that basically the people in the gap that we're talking about?
Yes, a lot of them are people in the gap.
Okay. Who aren't getting
Everyone in the
coverage.
gap is exempt from the penalty.
Right.
Because their income is too low to qualify for subsidies. So I hope that answers the question. And we can help over the phone as well if making an in-person appointment is...
Oh yeah, you don't have to come in person. You could just do something over the phone. All right, we'll put up all those numbers again in a moment. Let's go to Marcia. Hello, Marcia.
Yes, hi.
Hi, go ahead.
Hi, yes, I'm calling, I'm signed up for that marketplace, but the prices are so high. Is there someplace, because they said I had till till the end of the month. Is there another place? What about the healthtennessee.gov?
Okay. She's seeing high prices. Is there another place?
Well, I'm wondering, are you seeing high prices because you're not eligible for the help paying for the coverage? So the prices that
I'm on disability, Social Security, and I'm on oxygen. So I don't know if the high prices.
So you're on SSDI. Have you had that for 24 months?
I'm sorry?
You're on SSDI. Have you been on that for 2 years?
No, not yet.
Okay. And so,
I just got on it on 2015, and I've been on Cobra, and that's getting ready to expire. So, I mean, I am just lost. I don't know who to talk with.
so based on your income, we would be able to determine if you're eligible for some help paying for it. And when we put your specific information into the application, we can sit down to see exactly, you know, how much help you are eligible to get. And if you would like to call and make an appointment for an in-person assistant, a navigator like myself, to speak with you and help you to navigate that process, you can call the 844-644-5443 number and make an appointment. We can meet you at a library near your home, or, you know, a public place near your home, or we can certainly help you over the phone. So if you call the number, you will get a call back and we can assist you.
So we had a couple of callers before who wanted the number to talk to a navigator. That is the middle number. Is that right?
You can call either number.
The top one or the
either.
middle one?
Yeah, the middle number you can leave a message for a navigator, and it's a little bit more Middle Tennessee centric. The 844 number is statewide, but either way, you can get in contact with an in-person assister.
All right. Let's go to Katrina. Hello, Katrina.
Yes.
Go right ahead.
Yes, I just have a really simple question. If you enrolled in the Affordable Care Act or Obamacare in 2014, do you have to re-enroll for 2015, or what's the process to?
Okay.
So if you had coverage last year, do you have to re-enroll for this year?
Oh, that's the question.
Is that the question?
Yes. I'm going to say that's the question.
So it depends. There are some health plans that have been discontinued. If that is your plan, you will get a letter. In that case, you would have to re-enroll to keep your coverage. For everyone else, you do have the option to just start paying your new 2016 rate and continue the same coverage that you have. What we really recommend is to get in touch with a navigator or an in-person assister and talk about your situation a little bit. They can help you determine whether it'll be advantageous for you to go through the application process again. It usually is. When you update your information, you may find that you're eligible for a larger tax credit or more assistance paying for it. You can also compare with the new plans that are on the marketplace this year to make sure that you're getting the best plan and the best deal for you. So.
Okay. All right, we're going to take a break. Anne Marie, others stay on the line. We will get to your call. We'll take a break and be back right after this.